Hi, we are back with Dr. Neil Shah from Atlantic Health Systems, Atlantic Sports Health, talking about imaging technology. Dr. Shah, thanks again for joining us. Really intriguing, the advancement in this technology. You know, a couple questions. How safe are these technologies for kids, and when would you bring these technologies in the situation, in the picture for athletes?
Sure. So all these technologies are very safe. X-ray does use ionizing radiation, but we minimize the amount. And you know, one example we give is the amount of radiation one gets from an X-ray, say a chest X-ray, is the equivalent of traveling cross-country. So as you're in higher atmosphere when you fly, you get more exposure to some ionizing radiation just through natural exposure. And so 1 6-hour flight is the equivalent of a chest X-ray in terms of exposure.
Interesting.
So it's fairly minimal. It's something that we all kind of, well, outside of the pandemic, routinely do without a second thought.
Well, it kind of makes you want to travel less a little bit for people that travel a lot, right?
Right.
That's an interesting fact.
Yeah.
You know, I didn't realize the correlation of X-ray and traveling, but awesome.
Okay, and then, you know, ultrasound uses no ionizing radiation. There's really no harm there. It's completely non-invasive. And then MRI, as long as someone doesn't have some sort of, metallic implant in them, it's very safe as well. It's a strong magnet. And metallic implants are safe to use in the MRI as long as there are certain types, and we've checked that. And our technologists are very good at checking everyone.
Got it. And then when, you know, how would you guide these technologies with an athlete coming in? You know, what sets that precedent on what to use?
Sure. So when they usually come in, just to kind of get a general assessment of anatomy, alignment, they'll often get an X-ray. They might even have an X-ray before they've come in. They've gone to the ER or their non-sports medicine physician. The ultrasound is kind of more of like a fine technique where we're very targeted as to our question. We know there's one area that's bothering someone, and we use that. MRI, again, provides more of a generalized evaluation, but it gives you so much more information compared to, say, X-ray. So we can see the whole joint, and we can see all the fine little details.
Yeah. So would you say it kind of goes, someone comes in, you're trying to diagnose an injury, would it typically go X-ray, ultrasound, MRI? Is that?
Yeah, you may or may not do the ultrasound. It depends on the specific injury and what kind of question there is. But definitely X-ray, then next advanced imaging study.
Yeah. No, it's amazing. And I know, like we said in the previous segment, the technology is really advancing, continues to advance. And what's exciting on that respect is how Atlantic Sports Health is on that cutting edge.
Yeah, since I've been here, we've always been investing heavily in the latest, greatest tools that we can use, and you know, I'm proud to be using these tools and providing diagnoses.
Sure. I mean, you deal with a lot of professional athletes. You know,
That's
obviously
right.
the relationship with the New York Jets and whatnot. So you have advanced technologies here. You're dealing with some of the greatest athletes in the world, and that's what's exciting, having such a great offering here at Atlantic Sports Health for athletes and for anyone that's active or who has an injury.
I agree, and we also have a very professional staff that's kind of seen it all. So when they're setting up the examinations, they're able to kind of comfort patients and provide the best care that they need.
Awesome. Well, thank you so much for the information. It's very informative and helpful to really understand and seamless, you know, at this facility, at this hospital that really, you know, I believe has done everything it does everything it can to be on the cutting edge. So thanks so much.
You're welcome. Thank you.